Gentlemen, have you been using baking soda alone to improve your circulation, your blood flow, or your performance in the bedroom? Baking soda can instantly fix circulation problems, boost erections, or dramatically improve blood flow. Millions of men have tried it after watching short clips promising quick results. Some felt nothing. Others experienced stomach discomfort. And a few unknowingly put their health at risk. Today, we're going to clear up the confusion. Because according to urologists and vascular specialists, the real issue isn't baking soda itself. It's how people are using it completely wrong. And more importantly, why using it alone rarely works the way people expect. In this video, we'll explain the real science behind blood flow, erections, and circulation, and why combining the right compounds, not relying on a single household ingredient, makes all the difference. Let's start with the basics. Blood flow is the foundation of male sexual health. An erection is not simply a sexual reaction, it is a vascular event. When a man becomes aroused, signals from the brain trigger blood vessels in the penis to relax and widen. This allows blood to rush in and become trapped, creating firmness. If circulation is weak, erections become softer, slower, or harder to maintain. That's why erectile issues are often one of the earliest warning signs of cardiovascular problems. In fact, many urologists say erection quality reflects overall vascular health more accurately than many early medical tests. So where does baking soda enter the conversation? Baking soda, chemically known as sodium bicarbonate, is an alkaline compound. Some online claims suggest that it alkalizes the body and improves oxygen delivery or circulation. While there is a small scientific basis behind acid-base balance in the body, the internet has exaggerated its effects dramatically. Your body already tightly controls pH levels through the kidneys and lungs. Drinking baking soda alone does not suddenly transform circulation or hormone levels. In reality, excessive intake may disrupt stomach acid, digestion, or sodium balance. Here's what urologists actually explain. Baking soda may indirectly influence performance only in very specific contexts, mainly athletic endurance research, where buffering lactic acid delays muscle fatigue. But erections are not caused by muscle acidity. They depend on nitric oxide, vascular relaxation, nerve signaling, and hormonal balance. That's why using baking soda alone misses the real mechanism entirely. Now let's talk about what actually improves blood flow. The key molecule is nitric oxide. Nitric oxide acts like a signal telling blood vessels to relax and expand. When nitric oxide levels rise, circulation improves throughout the body, including the penile arteries. Prescription ED medications work primarily by enhancing this nitric oxide pathway, but the body can also produce nitric oxide naturally when given the right building blocks. This is where the mix becomes important. Urologists often discuss amino acids, such as L-arginine and L-citrulline. These compounds are converted inside the body into nitric oxide. Unlike baking soda, which does not directly increase nitric oxide production, these amino acids target the exact pathway responsible for vascular expansion. When combined with proper hydration and electrolyte balance, they help support healthier circulation. So why do some people mix baking soda with other powders? The theory is that buffering acidity may improve absorption or endurance effects during physical activity. But the real improvement comes from the nitric oxide supporting ingredients, not the baking soda itself. Think of baking soda as a supporting player at best, never the main solution. Another factor many men overlook is endothelial health. The endothelium is the inner lining of blood vessels. When damaged by poor diet, smoking, stress, or high blood sugar, vessels become stiff and less responsive. This reduces nitric oxide production. Ingredients such as beetroot extract, citrulline, and antioxidants help restore endothelial function, allowing vessels to respond properly again. This is why circulation improvement often takes consistency rather than instant fixes. Let's address a major myth. Faster results do not always mean better results. Many viral health trends promise immediate changes, but real vascular improvement happens gradually. Within days, some men notice improved warmth, better exercise endurance, or stronger morning erections. Over weeks, consistent support of nitric oxide pathways can improve responsiveness and stamina. This gradual improvement reflects genuine physiological change rather than temporary stimulation. Now, an important safety warning. Baking soda contains sodium, a significant amount. Excess intake can increase blood pressure, cause bloating, or create electrolyte imbalance, especially in men already dealing with hypertension or kidney concerns. This is why medical professionals strongly advise against using baking soda regularly without understanding dosage and purpose. The goal is supporting circulation safely, not overwhelming the body. So what does a urologist-approved approach look like? First, focus on nitric oxide support through evidence-based compounds. Second, combine that with lifestyle factors that naturally enhance vascular health. Exercise increases nitric oxide production naturally. Resistance training boosts testosterone. Walking improves endothelial flexibility. Even 20 minutes of daily movement significantly improves circulation markers. Sleep is another underestimated factor. Testosterone production peaks during deep sleep. Poor sleep reduces hormone levels, increases stress hormones, and impairs erections. Many men chase supplements while ignoring sleep quality, unknowingly sabotaging their results. Stress management also plays a powerful role. Chronic stress raises cortisol, which constricts blood vessels and interferes with arousal signals. This is why relaxation, breathing exercises, or mindfulness practices can directly improve sexual performance. The brain and blood vessels work together. When one suffers, the other follows. Nutrition matters more than most men realize. Diets rich in processed foods damage vascular function over time. Meanwhile, foods high in nitrates, such as leafy greens and beets, naturally enhance nitric oxide production. Healthy fats support hormone balance, while adequate protein supports tissue repair and circulation. Another overlooked component is hydration. Blood volume depends heavily on hydration levels. Even mild dehydration can reduce circulation efficiency. Many men experiencing fatigue or weaker erections simply aren't drinking enough water throughout the day. Let's also talk about psychological confidence. When men experience occasional performance issues, anxiety often follows. Anxiety activates the sympathetic nervous system, the same system responsible for fight or flight responses. This constricts blood vessels, the exact opposite of what erections require. Supporting circulation physically while rebuilding confidence mentally creates the strongest long-term improvement. So the real takeaway from urologists is simple. Baking soda alone is not a solution. Blood flow improvement requires targeting nitric oxide production, vascular health, hormones, and lifestyle simultaneously. When the correct compounds are combined intelligently and supported by healthy habits, the body begins restoring its natural performance ability. Many men are surprised to learn that erectile function often improves before other health markers. That's because penile arteries are smaller than coronary arteries. When circulation improves there, it often signals broader cardiovascular improvement. In this way, sexual health becomes a window into overall wellness. Consistency is the secret most viral videos ignore. The body adapts slowly but powerfully. Supporting circulation daily leads to cumulative benefits: stronger energy, improved endurance, better confidence, and more reliable performance. Before trying any supplement combination, especially if you have heart conditions or take medication, consult a healthcare professional. Personalized guidance ensures safety and effectiveness. Responsible education always beats internet shortcuts. In the end, the message is not about a miracle powder or a kitchen ingredient. It's about understanding how your body actually works. Nitric oxide, vascular flexibility, hormonal balance, and mental relaxation all contribute to healthy blood flow. When these systems work together, improvement becomes natural rather than forced. So if you've seen claims about baking soda fixing everything overnight, remember this. the science tells a different story. The real solution isn't a single ingredient. It's the right combination, used intelligently and consistently. Better blood flow isn't just about sexual performance. It's about heart health, energy, confidence, and longevity. When circulation improves, every system benefits. And that's why urologists emphasize education over shortcuts. Take care of your vessels, support your body's natural chemistry, and focus on sustainable improvements. Because the strongest results are not the fastest ones. They're the ones that last.